Nkomo Ralehoko says that this new administration is working around the clock to improve infrastructure on healthcare facilities.
What we have been doing in the sixth administration is to make sure that now we start maintaining our infrastructure, especially in the hospitals and the clinics. Some of our clinics that we have done, we have newly built clinics now, as I was indicating to yourselves that we have just opened your Zone 17, your Kekana clinic in Hammanskraal, Kutsong, the rest of them, including improving some of the MOUs in the communities, especially the Davidton one.
Nkomo Ralehoko says they have found a solution to address the issue of staffing in the healthcare fraternity.
The issue of employment of staff, you are correct. We have a problem of capacity in some of the areas, and we have identified that as a problem. We are busy now trying to allocate some nurses to various hospitals and clinics where we have a shortage of nurses, because that has been one of our critical areas. It was not done because of our liking. Some of the old nurses now are retiring, but we're bringing them back in the system now, because I think HOT brought about 2,000 in the sixth administration that are working on integrated school health program that we're having. They are working in the department, they're back in the system again. But because there was a time that the government was not training nurses, that's the time that has created this gap when it comes to nurses. But we are now, we have a skills development unit in the department that we've activated that must focus specifically on training. And our training is not only nurses, it's including the people that must work with those nurses, those doctors, so the admin staff, because the hospital can't function with a doctor and a nurse.
Gauteng Health Head of Department Lisiba Malutana has admitted that they have a huge deficit, but they are working around the clock to resolve it.
There's a 250 million maintenance shortfall budget just for the upkeep, and that's an argument that we are taking to the province to say there's an old dilapidating aging infrastructure. How do we maintain that without building new, but just to make it work? The Tom London issues, because those issues matter and those that people are experiencing. How do we? Luckily, there is a province. The province has responded to say, please quantify those needs and come and see how we help. That's where we'll be going this afternoon, to make a business case of saying, whilst we can't build as much as we want, let's maintain and make the current functional, and so that at least the bare minimum.
Nursing Union DINOSA has weighed in on the MEC's pronouncements.
In terms of employment, we will wait and see, because currently we are still engaging the department in terms of having to address the issue of nurses who are said to be out of contract, the ones who have completed training, because the Nursing Council has done away with the board, which was a condition for them to be employed. So now a board of exams, yes. Now that being done away, we're hoping that it will fast track the process of them being appointed in the department, because the issue of shortage of nurses is a reality that our members live with on the ground.
DINOSA says if the Gauteng Health Department can address the staff shortages that their members are being subjected to, that will assist in addressing service delivery issues in the province. Calvin Lula, SABC News, Mamelodi, Pretoria.